Hi and welcome to the Healing Hive Health Series at Healthnox Clinic, powered by the Academy of Champions. Today's topic is cancer. So pretty much every household that I visit or wherever I go to public gatherings, there's almost cancer in each household. So someone's relative or member of the family, someone somewhere is affected by cancer. And so what I will share with you today is generic guidelines on how to address cancer. There are so many types of cancer and variations and different tissues that are affected, different cancer cells. What I'm going to give you is a general guideline. So this is something that's applicable to most types of cancers and is a generic guideline. So one of the things that when I was studying this topic that I came across was this research done in 1931 by the Nobel Peace Prize winner Dr. Otto Warburg. He was a German scientist, and he mentioned from his research, based on his research, that all forms of cancers have two basic conditions: acidosis and hypoxia. So by acidosis, he meant that the body becomes acidic, and hypoxia, that the tissues lacked oxygen. And he said cancerous tissues are acidic, whereas healthy tissues are alkaline. He said that deprive a cell 35% of its oxygen for 48 hours and it may become cancerous. So these two factors are paramount. And so based on this research, the solution that I propose to those that I've treated in cancer, and you can see my videos on the Academy of Champion channel, that I've been blessed to treat those with liver cancer, I've been blessed to treat those with even brain tumors, and most recently someone with high PSA levels, so prostate cancer. And the strategy and approach more or less has been the same. And so the generic guidelines that I want to share with you, which I implement, are these. So firstly, you need to eliminate all your sodas and sugary items that you consume. All of them. Because there is a theory, there is a research group that believes that cancer is a form of fungus. And essentially, any living organism, the main food that it needs is sugar, so glucose. And if you provide that in abundance, then it will thrive, it will grow. So the idea is first to eliminate as much as you can the food for this pathogen, the food for this, whatever you want to describe it based on your research, whether you believe it to be a fungus or whatever type of living organism that you believe the cancer is, the cell is. You need to eliminate its food or limit its food, the supply. Secondly, you need to optimize your diet. And there's no better way, in my opinion, doing it than getting a bioenergetics test done through an SI or a CAST4 or other various machines, electrodermal screening devices that there are. Get a food, or you can even get a blood test done, get your IgA levels tested for various foods and see how they react. So get a food sensitivity, a food tolerance test done, right? And optimize your diet. That's the second step. Third step is to switch to an alkaline and low glycemic index diet. That includes ionized alkaline water. So the literature that you can find, I've shared it in a number of places, is that with ionized alkaline water, there's enough studies to show that it helps treat cancer patients. It limits, it hinders the growth and often causes the cancer tumors to regress. So there's enough study on that to prove that works. And also a low glycemic index diet means food that slowly releases sugar. So the key idea is that the high glycemic index diet, when you give so much sugar and sugar that's released quickly, that spikes, your tumors or your cancers instantly absorb that and allow them to multiply and grow. If you switch to a low glycemic index diet, the theory is that your body absorbs, or your other cells absorb the glucose, and you starve or you limit the supply of glucose to your tumors and cancer. And so therefore, over a length of period of time, you prevent them from growing and expanding. So those two things, alkaline, low glycemic index diet. For more details about these two, you can even read my book, The Ultimate Bioreactor, the 4 key factors of optimal health, and the link for that will be in the description below. And lastly, breath work, because there are 2 factors, just to recap. One is that if your cells are acidic, if you suffer from acidosis. Secondly, a lack of oxygen, hypoxia. So you can address acidosis by switching to an alkaline diet and drinking ionized alkaline water. Hypoxia, however, is helped by ionized alkaline water also, because what you have to remember is the ionization process, OH minus ions are what produce the alkaline water, so there's more availability of the oxygen there, and as well as the active hydrogen. And so alongside that, you need to have a breathwork practice. Whether it's Kriya, which is done in India and the Indian subcontinent, people had that as a breathwork historically. So whether you do that or whether you do other breathworks, so it could even be, in the Skiya Tasawwuf, Islamic spirituality, in Sufism, the breath practices that they have, through zikr or remembrance of Allah, you can do it that way. Whatever or you can just simply do breathwork practice, deep breathing practice, whatever technique you want to follow. The idea is to increase the O2 level, so oxygenating your body. That's the key thing, because like Dr. Otto Warburg mentioned, that if you starve, if you deprive a cell 35% of oxygen for 48 hours, it may become cancerous. So you want to do the opposite. And this is also why you want to completely avoid carbonated drinks, because the carbonated factor of it, the CO2 level in it, which makes it carbonated, that is what leads to the acidity. So the CO2 and the acidity are linked, and this is why carbonated drinks are legalized slow poison, in my opinion. And lastly, it's the zapper, the frequency generator device, which I mentioned in some of the other previous videos. You can dial in whichever cancer you're suffering from and pass those frequencies. I use that to treat the brain tumor patient, and I also use that to treat the liver patient. So these are the essential steps. These are the basic steps that I use to treat a cancer patient. And like always, you're open to your own opinions, you're open to ask any healthcare practitioner and listen to professional healthcare practitioner advisors or a good function medicine practitioner to help you address your issue. Thank you for listening.